please wash your hands. Wash your hands, I tell my children and grandchildren quite frequently. But when it comes to telling other adults to wash your hands, I don't have the liberty. So I decided a little knowledge on hand washing. It may encourage you to wash your hands more. I had a coworker who left work after not even being there a whole hour one morning. She was very ill, complaining of stomach and a lot of bloating. She, after going to the emergency room, being admitted to the hospital, going through several days of pain because it took a while to find out what it is, and multiple tests, they discovered that she had a gastrointestinal infection called Clostridium difficile colitis, better known as C. diff, which is spread through touching things that is dirty. So whether she contracted it at the hospital, her mother was in the hospital, or on the job, she contracted the bacteria. It was already big. I was already big on washing your hands, but now I'm even more so. I would like to inform some, conform to others about why we should wash our hands, when we should wash our hands, and some misconceptions about hand washing. Why should we wash our hands? A. It prevents some illnesses. B. It reduces the number of people who get sick with diarrhea by 23 to 40%. C. Reduces diarrheal illnesses in people with weakened immune system by 58%. D. Reduces respiratory illnesses like colds in the general population by 16 to 21%. And E. Reduces absenteeism due to gastrointestinal illnesses in school children by 29 to 57%. All of those percentages came from the Center for Disease Control and Prevention. And the Center for Disease Control and Prevention also says keeping hands clean is one of the most important steps we can take to avoid getting sick and spreading germs to others. Many diseases and conditions are spread by not washing hands with soap and clean running water. There are several myths about hand washing. I only decided to do 5. A. Some people build that it builds immunity. That's not true. According to Dr. Christopher S. Baird, in May 3, 2013, he says not washing your hands does not make you a healthier person. I did some more research and it talked about people who get it from the same concept as immunizations. But with immunization, you're shot with one particular thing. In not washing your hands, your body comes into so many things that it doesn't build immunity. The antibacterial soap is better than other soaps, and that's false. Any soap is good, and antibacterial soap has not been proven to help any better. And that's according to Victoria State Government and Better Health Channel. Another myth is you don't have to dry. That's false too. That's a myth too. You have to dry because your hands you can spread more germs even with wet hands. And another misconception is hand sanitizer is just as good as soap. It works if you don't have soap and running water, but anytime you have soap and running water is preferable. Wipes are good. All of these, anything is better, but they don't get rid of as many contaminants as soap and running water. When you should wash your hands. Taken from Victoria State Government and Better Health Channel and Aurora Healthcare, they say you should wash your hands after changing a diaper or going to the restroom. Next, after coughing, sneezing, or blowing your nose. Before eating. After touching animals and or their waste. After touching sores, cuts, or infected areas. After getting visible soil on your hands or playing or working outside. before and after handling raw meat, poultry, or unwashed fruits and vegetables, before taking medications, and before putting contact lenses in your eyes. I'm not trying to make hand washing an exact science or saying we must scrub like surgeons all the time. But if washing my hands just a little more can help from spreading one virus, cold or flu, or or if this information helps my family, friends, and me from getting sick in it even 10% less, then it's worth it. My daughter has worked at 2 hospitals and 1 nursing home. She says C. diff is very common in hospitals and nursing home settings. Some hospitals are adopting rules that you have to wash your hands ever so often. So, remember, wash your hands.